Hey, joining us this morning from UK King's Daughters, we have Dr. Sonia Lichtenstein. Great to see you today.
Nice to see you too.
Yes, and we're talking about wound care. Why is wound care a specialty at UK?
So wound care is something that's kind of developed over time because of the number of people that we're seeing that have wounds that just don't heal in a normal time frame. You and I, we get a cut, a scrape, and we expect those to heal within a week or two. These are the people that have some underlying factors that cause them not to heal correctly. So what a wound care specialist really does is kind of coordinate the underlying conditions that can cause wounds not to heal, whether that's their diabetes, whether they have some type of infection, whether they have some swelling that's not well controlled. Those are the kind of things that can keep them from healing. And that's what we kind of do is we look at that, we put the pieces together and coordinate the care to make sure that we can get them heading in the right direction.
Right, because left untreated, that could be a horrible situation. So what makes the King's Daughters Wound Center so unique to our area?
So the big thing with us is because we are part of the bigger organization, we have good communication through our medical records, easy access to any testing that's been done. So if someone comes in, sees me, I can know how their diabetes has been managed recently. Is it under good control? I can see if they've seen the infectious disease doctor. I can see what the vascular surgeons are saying. I can see what their primary care physicians are saying. And some of that is giving me access to some of their social situations, which could be part of what's keeping them from getting better also. So it's really the communication and the coordination that's available through a big organization like this that can help expedite some of the care. We don't need to wait to get records. We don't need to wait for a return phone call all the time. So that helps expedite the care, get them to definitive management for their wound sooner.
Oh, that's great. And who do you typically treat? What type of patients benefit from wound care?
A lot of our patients we see are diabetics. And, unfortunately, in this community, there's a fair number of diabetics. And a lot of times, one of the big concerning things that we see with our diabetics is they come to us later than they need to be. So we have a fair number of patients that end up with amputations because of their diabetes. And one of the statistics are there's 80% of amputations can be prevented. So we really try to reach out to these people. So anybody, a diabetic that has any type of wound, blister, drainage coming from their feet, that's somebody that we need to see sooner rather than later. And then anybody who has sores on their legs that have drainage coming from them, they're kind of weeping, those are people we can help. Anybody who has a surgical wound that is not healing in a standard amount of time, and then pressure ulcers. Those are the most common ones we have. There's always those atypical type of wounds that we can see and do treat, but those are the most common ones. But again, all of those have underlying factors that we have to address to get them better.
Mm-hmm. I read that you all have hyperbaric oxygen chambers. How do you use these in the treatment plan?
So the hyperbaric oxygen chambers, they're these large acrylic tubes where you go completely into the tube, you breathe 100% oxygen, and we increase the atmospheric pressure there. So this can help promote healing. It can help fight infections that are within the wound. We use this a lot for bone infections. This can also help some patients that are not typically wounded patients, but patients that have had radiation in the past, like such as bleeding from their bladder from previous radiation, people that have non-healing wounds because they've had radiation in the area. The radiation can affect that tissue from healing correctly. And so hyperbarics we can use in these kind of patients also. We do use it as an adjunct to what we have in addition to we have like skin substitutes, some advanced dressings, but the hyperbarics is something that's kind of specialized and unique. We have several of our staff members that are trained, and I have my board certification in hyperbarics, and so it's something that we can add that isn't always readily available.
Mm-hmm. How would someone know if they are at the point where they need to come see you all?
So that's kind of hard to say it general terms. But if you have a wound that you've had for, say, a week or so, or maybe even shorter than that, and you know you've had problems healing in the past, give us a call, and there's no referral needed. Give us a call. We can get you in as soon as possible. If you can't get into us very quickly, you can see your primary care. Sometimes you can just get some antibiotics until you get in to see us, but we don't need a referral. Give us a call. If there's anything you're concerned about, we'll be happy to see you. You know, let's take a look at you. Let's see what we can do to help you. And if you don't need to keep coming to us, that's a good thing for you.
That is, and again, don't put it off, because you all have so many ways that you can help people who are in this situation. So, Dr. Lichtenstein, thanks so much for sharing some of the treatment options you all have at UK King's Daughters.
Thank you very much.